I'd like to call the Benton-Franklin Health District meeting to order. Today is Wednesday, September 18th. We'll actually jump into executive session right first for like 30 seconds, 5 hours.
Oh, let's go
15 minutes, okay. So we'll go into executive session, discussion on legal counsel, current potential litigation. Randy, Tate, Tony, Chris, and Janae will be in here as well. All right, we're out of executive session, time 1:48, no decisions were made. Moving on, can we get approval of August 21st, 2024 regular board meeting minutes?
Approval of the minutes of August 21st, 2024. Second that.
And motion is second, any discussion? Hearing none, all in favor, say aye.
Aye.
Any opposed? Okay, is Rocky's online?
Yes.
Okay, gotcha. Public comment, anybody here? Don't see anybody?
If you'd like to make a comment, you can press *9 if you are on a phone, or you can raise your hand inside the Zoom app.
We were not in the main session, so everyone couldn't hear us. What you
Oh.
just said.
Okay.
Yeah, just go back again. Still go back in? Yes. So they can hear us now then?
Yes.
Okay, we had some technical difficulties. We were out at 1:43. I don't know, we're out executive session appropriate time. No decisions were made. And then we got approval on the August 21st, 2024 regular board meeting minutes. And then public comments, if you're online, please raise your hand.
I'm not seeing any hands.
Anybody? Okay, we'll close public comment. Senior staff comments, if any, none. Great, moving right along. New business. Mr. Krager. Welcome to the wonderful Tri-Cities.
Thank you. It's good to be here. There's really no one else before me? Okay. Got my slides, right?
Yep, I'm getting it right.
So yeah, I'm Dr. Steve Greger. Oh, thank you. It's good to be here. My second time visiting the Tri-Cities. I wasn't able to make a third technically, but wasn't able to make a Board of Health meeting last time, but it's good to be here. I am the interim health officer. And yeah, I'm excited to meet the board members in person. I'll be here, afterwards if you want to chat a little bit. I'm just kind of hanging around. So I'm going to talk about, this mouse.
Yes, you are.
Okay. Sorry. We're just getting used to this system. Okay. Just a couple, I have a few slides just on fall and winter respiratory kind of disease season. So it is almost fall. I think in a couple days. That's when we classically think of, a lot of respiratory illnesses spreading. Influenza is kind of our classic one, but a number of other ones also spread. RSV is one that we've kind of learned more about as, especially as we've had some more preventive measures come around. COVID-19 kind of doesn't quite have a season, I will say, because we see surges at different times, but certainly does seem to often surge during the winter as well. So I'm going to talk mostly about those. I'm going to touch on some other ones. I'm going to go over just briefly some of the data. You've probably seen these graphs a lot, so I'm not going to go over them super in depth. Talk about vaccines, and then touch on a couple other respiratory illnesses that we see and we've been kind of talking about a little bit. All right. This is weird. What's that slide?
Hold on. Here, let me drag.
Okay, you drive. Might just have you drive because it might be split.
Okay.
Thank you. Okay. Okay. Our again, kind of our classic understanding is, we kind of gather inside. Schools are in session. We do see more respiratory viruses circulate. Not every virus follows that rule. Obviously, there's some that we see more in the wintertime, in the spring, summer. But in general, this is the time, especially in public health, we think about like vaccines, influenza, that sort of thing. Like I mentioned before, influenza and RSV, which is respiratory syncytial virus, usually peaking sometime in the winter. We hope, at least from a healthcare perspective, that they're often peaking at different times so that we don't overload our healthcare system. And then COVID-19, we've only had around for a few years, so it's kind of hard to have a clear pattern. But we've always seen at least some sort of increase in the winter, but no true season right now. So next slide. All right, that's a little small, but we'll make do. I put this up. This is hospitalizations for COVID-19 for the whole state. So the last few years. So the pink line is this year. And mostly I kind of want to point out like the progress that we have made. So the peak that you see in January, that dotted line is 2 years ago, which I think would have been here, at least when it first started emerging. And then last year is that other dotted line. And we actually had a little bit more issues statewide kind of last summer than we did even last winter. This year, those peaks are even lower in that pink line. Oh, there I am. Can you go back so I can see it? Okay. Thanks. Thank you. So all that to say, this is like a percentage of hospitalization. So at the very top of that line is 20%. We're kind of hovering. We hover between like 2 and 4%, and that's kind of where we bounce around. Still causing people to go to the hospital, but not nearly at the level that we've seen in the past. So, and this is statewide. I think my next slide is Benton and Franklin counties. Kind of a little noisier data. You'll notice that's because we have smaller numbers to work with, so you'll just see more ups and downs. I will say that. It's not the exact, this is one graph as opposed to 3 different lines. And it also goes back all the way back to 2020. But a similar kind of spikes, usually during the winter time. Right now, we're having a little spike compared to where we were in the spring. And you see that both with hospital admissions. And then I think the next slide is emergency department. Go to the next one. Yes. So people are going to the ER, and actually now we're kind of approaching where we were last winter, right about above it. So we have had at least an emergency department visits. There's a little bit of discordance there between what we're seeing inpatient admission wise versus ER. So people might be sick enough to go to the ER, but not necessarily be admitted to the hospital. All right, let's go to the next slide. Influenza, this kind of same statewide graph. The last 3 years. 2 years ago, we also had kind of a worse influenza season. That's that dotted line that has the biggest spike in kind of November, December. And then let's see, this last year was the green line, and then the year before that was 2 years ago. So this last influenza season was that green line, and it was comparatively less. That's pretty normal. We often see like kind of a lot of variation in terms of severity, in terms of influenza. Right now, we have basically 0 influenza, at least causing hospitalizations across the state. All right, let's look. I think the next is RSV. I left out our Benton-Franklin data just because we have larger numbers with influenza and RSV statewide, and I think it just paints a more complete picture. Again, not to belabor it, but we're kind of seeing similar peaks during the wintertime. RSV, so we're most concerned about very young infants, and as well as people over the age of 65. Some people with chronic medical conditions are more prone to more severe disease. I will say the majority of cases that cause hospitalization are in the youngest infants, but we do see it in people over the age of 65 as well. I can't remember if I've made this point here before, probably not because I haven't talked about RSV, but I have very distinct memories of working as a pediatric intern during RSV season and getting admission after admission into the hospital of RSV infants and struggling to breathe. And, you know, most of them end up being okay, but it can be a pretty severe illness. All right, let's go to the next slide. Okay. Hope we're all, you know, familiar with vaccines. I'm going to go over them quickly and then just highlight a couple points. And this is very similar to kind of what we've had the last year or so, or the last season as well. So hopefully this is becoming kind of more familiar. COVID-19 vaccine has been updated. It's everyone aged 6 months and older is eligible. Remains, you know, it does decrease the likelihood of severe illness. And then, so we have 3 options: Pfizer, Moderna, and Novavax. I do like to point out Novavax for people who might have questions about the mRNA vaccines. It is a non-mRNA vaccine. Influenza, we recommend every year. Also for people ages 6 months and older. Similarly, it reduces the risk of flu illness, hospitalization, and death. I have one more point about flu, but that's on the next slide. RSV. Okay, so we kind of have 3 different groups. People ages 60 and over. We'd recommend talking with a healthcare provider. I will say over 75, I think it's on the next slide too, is like a stronger recommendation. Regardless, I think talking with your healthcare provider is a good idea. Pregnant women, this is to protect pregnant women, but also probably more so to protect their infants. So, the newborns end up getting, you know, what's called passive immunity. So, antibodies through their mom that protects that infant after it's born, which is pretty cool. For higher risk infants, we also have what's called a monoclonal antibody. And that's especially helpful in infants whose mom maybe didn't get the RSV vaccine. And we've seen some like really nice results from the new kind of RSV vaccines, especially in preventing, those really sick infants, which is great to see. So other infectious disease, because I ended up not putting on a later slide because I wanted to keep things a little bit shorter. We put out a provider advisory about whooping cough, also called pertussis, not too long ago, because we'd seen some transmission. This is a statewide issue. It's not unique to Benton-Franklin. Some counties have been hit a lot worse, I will say. And it also kind of goes through cycles where we don't have whooping cough for a few years and we end up having quite a bit. So just something to think about because we do have vaccines for it. Same with measles. We haven't had measles. Let's see. There were some measles cases in Washington earlier this year, but currently Oregon is experiencing kind of an ongoing outbreak. It's not huge. I think they have about 32, 33 cases. But again, something to keep an eye on. Okay, let's go to the next slide. Just a couple more like things I wanted to point out. We don't have hospitalization data, obviously, for this year's booster of COVID-19, but we do have last year's. Reduced the chance of like hospitalization and severe disease by 40 to 60%, which I think is pretty good. That's similar to numbers we see for the influenza vaccine. 2 things with the influenza vaccine. For a few years now, we've had a higher dose, which is available and recommended for people at only the age of 65. This is the first year that I've seen this language from the CDC where it basically says if you have an egg allergy, you can get kind of whatever vaccine you want in terms of influenza. So they used to have more cautionary language or getting a non-egg-based vaccine for influenza. They're saying right now, they've looked at the data, like it doesn't really matter, which is kind of nice. And then similar to the past, we have shots and then nasal spray available for the influenza vaccine. All right, I think I have maybe one or two more slides. This graphic I stole from a wonderful blog called Your Local Epidemiologist because I thought it was the best kind of summarization of the RSV breakdown. I'm not going to go over everything. I think I've talked about most of it, but not, the one thing I wanted to note is that the RSV vaccine is not, for the older adults, is not annual. Right now, it's just like a one-time thing. So that's kind of nice. But if you didn't get it last year, it'd be a good idea to get it this year. The pregnancy one, I think is going to be recommended pretty much every pregnancy for pregnant women. And then the monoclonal antibody, all infants, if mother didn't get RSV vaccine during pregnancy, and highest risk infants. And then let's go to the next slide. Okay, oh yeah, this is it. I wanted to highlight some a website that Benton-Franklin Health Department worked on called Stay in the Loop, which is really nice. If you go check it out, I put a couple of the graphics there. It's just like kind of like, I don't know, a slightly more easier to consume, easier to find resources about, you know, especially for kids, but also for adults, kind of what vaccines you might need. It's got some great, you know, links to find out, you know, your vaccine history, questions and answers about vaccines, that sort of thing. And then just the CDC website there for if you have more questions about respiratory viruses this season. And I think, is that my last slide? That's my last slide. Whew. I did that really fast, but happy to answer any questions or discuss that. Otherwise, it's really good to be here.
Any questions? Go ahead.
Yeah, Dr. Krieger, just an observation. I noticed that COVID on the uprise in June and July, I know so many people that traveled, and I think that was probably they were bringing it home or getting it from somewhere and bringing it here. So
Yeah, I've been trying to research that a little bit because we've often seen a little spike during the summertime too. And like, what is? I mean, travel might be a great reason for why that is. A lot of people kind of mixing and traveling around for sure.
Any other questions?
You had a slide with emergency department visits. Does that include urgent care?
Don't believe it does, but someone from our MB team might. I think it does not, but I'll double check. Yeah.
Thank you, doctor.
Yeah, thank you.
Who wants to give us the on-site sewage rule up?
I don't have slides. I just get to stare at myself.
Come on down, you're the next consultant.
Hi, everyone. Erin Hockaday, Senior Manager for Surveillance and Investigation. I'm going to do a really quick update on our on-site sewage rule revision committee progress, and then I also will be giving a really brief update on a proposal for a new kind of community outreach that we're planning on doing with some of our local and municipal planning departments that sort of relates to on-site sewage. So Jody and I have brought you a few updates on the on-site sewage rule revision over the last 6 months. As you remember, the state updated their rule, which kind of pushed us into the process of updating our local rule. So we're hoping to bring you the draft of that sometime soon. So we did commence a committee, an on-site sewage rule revision industry committee, so that we made sure to consider the opinions and participation of industry in the process. So that group did commence a couple of months ago. We've had participation from industry. We've had a on-site sewage, a developer, so a land developer, one septic installer, an on-site sewage system engineer participate, a community member, and then a Board of Health member as well. So we've had good participation there. We've met 5 times, I think. So the topics so far that have been discussed are, we did one meeting where we went over the background of the changes to the state code. So the WAC, just giving the background of our local rules and regulations. We talked about BFHD's proposed changes to the draft. We had a specific meeting just to discuss lot sizing and minimum land area, and then a specific meeting just to discuss nitrates and on-site sewage systems, which sort of relate to the minimum land area topic. This Thursday will be our wrap-up meeting, so we'll have kind of an opportunity for last thoughts and discussion and revisions. After that, beginning in October at these Board of Health meetings, we're hoping to start bringing you pieces of that draft because it is a big rule. So we don't want to pop it in front of you and say, here, approve it. So we're going to try to break it up into chunks. So ideally, we'll have 3 months. Jody will come give a brief, probably 10 to 15 minute presentation at each, just to present, here are the sections that we're proposing to either come into alignment with the state code, retain our kind of unique language or to modify, so you can get an idea of what it is that you'll be looking at in early winter. Past that presentation, we still have some pieces of the process we need to tackle. We have to go through a public comment period. We have to submit the draft of the rule to the Department of Health, and they have 90 days to review it and approve our local rule. And then we can, after we go through the SEPA determination process, then we can bring that back to you for approval and review. So that's the kind of timeline on that and the plan there, and we will be bringing you more information on that soon. Related but unrelated to on-site sewage. Recently, we have received quite a few inquiries about our on-site sewage processes, land use processes, some inquiries from Board of Health members, some from community members. Some of them kind of how our turnaround times look and how our processes are interfacing with local county and municipal planning departments. So we do, we do strive to bring seamless services to our clients and expedited services. We have had some challenges in the area of land use and environmental health in general, with staff turnover, with workload and capacity because of the increase in building and development. Our land use turnaround times are better than they have been, but they're still running a little bit further out than we'd like them to. So what we'd like to do is we are proposing to reach out to our county and municipal planning departments and try to put together maybe a biannual, maybe a quarterly meeting where BFHD can meet with the county planning staff, and we can work on just doing some discovery where we can align our processes, where we can enhance each other's processes, because a lot of them overlap. So we have applicants going there and then they need to come here, and it may be possible that we can align them so we can expedite some of those services a little bit. So I'm bringing this here because once that meeting commences, we would like to invite one board member from each county to electively attend those meetings, just to get to know our processes a little bit better, bring your feedback. Obviously this is optional, but just a good opportunity to kind of get a little bit involved with what BFHD environmental health programs are doing and bring that voice to the table. So we'll bring you more information once that is solidified. Questions on either of my updates?
Erin, can I just add in there real quickly? It's not just county representation, that it would also be somebody from our non-electeds group, if you guys are open to that. So one from each county and then non-elected to be able to participate in those bi-county meetings.
Perfect.
Thank you.
I'll volunteer Michael since Michael's not here. And you can volunteer Clint since Clint's not here either.
Yeah, we can all.
Yeah.
Environmental health.
We already know the process and.
Thanks.
That's easy.
Mr. Kyle,
Now you see the hazards of missing and missing.
you're the next contestant on.
I'll move the podium, please.
I'm just gonna move it out of the camera. All right, good afternoon. I'm here to update you guys on the audit that BFHD underwent over the last few months. We had two different audits. The first was on our financial statements, and the auditor issued an unmodified opinion on the fair presentation of the district's financial statements in accordance with its regulatory basis of accounting, which is what we want to hear. That was their words, not mine. They also reported no deficiencies in the design or operation of internal controls over major federal programs. That is also something like that.
That's great.
So on our financial statements, we did have one finding, and that was in regards to our subscription-based information technology assessment liability. And this was a new standard that they would like us to report on. And we did not this year, so that was missed, and that was subsequently corrected by the district. So we did report it after they had found that we were deficient in that area. The second audit was our federal single audit, and this goes over any of our federal grant programs. So this year they audited our WIC program, our COVID-19 funding, and our NFP program. And the auditor issued the opinion that the district complied in all material respects with the types of compliance requirements that could have direct or material effects on each of its major federal programs. It's very wordy. So that's what we'd like to hear in that case as well. We did have one finding in our COVID-19 funding, as the health district did not follow the procurement policy when contracting with a vendor. We did not obtain 3 quotes for a vendor that we paid over $10,000 for the year. Overall, the audit was successful with a few areas that we are aware of in the future. We have audit report 1035622 that is available on the auditor's website, or if you'd like a copy, I can email that out to you guys as well. Any questions?
Congratulations.
Thank you. Good job. All right. Re-accreditation. Oh, Ms. Janae?
Yes, okay, hi.
I passed,
Hey.
yeah, sorry, Janae, and then.
It's because I'm not there in person, huh? Saying, hey. All right, so last we had briefed you all, we were preparing for a visit from state legislative group, and we were going to have several state officials here with us to go over our foundational public health services and all the great work we've been doing here. However, I wanted to let you know that that legislative visit was canceled. It sounds like they are preparing for session again. And so they have promised us that they'll be back this spring. However, great conversations and concepts were already being pulled together in terms of what we've been doing here locally with the foundational public health funding. And so what I'd like to propose as an alternative is that this December we bring back to you all, and then possibly any others that want to listen in, what's been going on here in the last couple of years of the work that we've been doing, and in hopes that that concept that we bring forward of we can do this annually, preparing you all for what we've been doing, and then also preparing our staff for what we call Ledge Day. So usually every February we go to visit the legislators over in Olympia, and we talk about how we've been utilizing the funding. And so what we bring together in December would be what we would immediately use as handouts or conversations in Ledge Day. So that's our alternative plan B for not having this sit down, but then we'll hopefully get to be able to do that in the spring. And those that want to join here from the board, we would continue to welcome your guys' involvement there. So there's the update. If you have any questions, let me know.
Thank you.
Yep.
Afternoon, everyone. It really is my turn this time. So, most of you know that the next step in our Public Health Accreditation Board reaccreditation process is a virtual site visit from the evaluators. It's a site visit, but they're not coming here this time. So the dates and times have been set, and there is a desired opportunity for board member involvement. We don't have a final agenda yet, but have been told if we get through all of our content on day 1, they won't come back for day 2. So hopefully, day 1 is our priority day for engagement. The dates are Tuesday, October 29th from 9 a.m. to 1 p.m. and Wednesday, October 30th from 9 a.m. to 1 p.m. And so please let Janae know if you have availability and interest in participating, so we can make sure to get an agenda to you as well as invitation, so you know what's happening at what times. I'm going to add to that our CHIP annual report, so the Community Health Improvement Plan. One of part of our accreditation requirements and good public health practice requires us to have a community health improvement plan and provide updates to the community on the progress of that plan with our partners. So this is the first year we've done an annual report, which you'll find in your packets related to the Community Health Improvement Plan. We are really grateful that our FTHS funding has allowed us to expand staff capacity to help us do this work. And we hope you'll find some time to review it. If you have any questions or comments, please reach back out to me, and I'm happy to provide additional information.
Thank you. Go ahead.
Yeah, Carla, I just was gonna say that our Rotary Club would love to have a presentation of the CHIP.
Okay.
So I will give you that information.
You know,
That
we'll
can be
be
part of your
public.
outreach.
Absolutely, happy to do that. And there will be some social media opportunities coming up too, where we're interviewing partners and collaborators to get that information out. Great.
We get a motion on the vouchers.
Oh, I can. I move that we approve vouchers number 66, 2024 through 70, 2024 in the amount of $878,844.34.
Second. Have a motion and a second. Any discussion? Hearing none, all in favor say aye.
Aye.
Any opposed? Still can't hear Rocky, but okay. You guys have it. All right. Is that it? You guys got anything to say? Or? Good, okay, all right, next meeting, October 16th. Bring the donuts.